Welcome back from lunch. We were planning on having Kate Dobler from Access here for the next presentation, but she was not able to be here, so she graciously agreed to tape her presentation in advance. She is willing to answer questions, so you are welcome to contact Kate through her email. Her address will be on the slides and in the chat box. Let me tell you a little bit about Kate. She has served on the planning committee for this summit and is our go-to person for answering all questions about what's happening in perinatal services. Kate is the Access Project Director for the 2.7 million SAMHSA pilot for the treatment of pregnant and postpartum women. She received her bachelor's degree from the University of Arizona in family studies with an emphasis in child development. She earned her certificate in public management from Arizona State University and holds a master's degree in educational leadership from Northern Arizona University. Kate will introduce us to the Arizona Pilot Grant Program for treatment for pregnant and postpartum women.
Good afternoon. My name is Kate Dobler, and I am the project director of the Arizona State Pilot Grant Project for the treatment of pregnant and postpartum women with substance use disorder, which is a really long name that we refer to as PPW-PLT. And I am incredibly honored and grateful to be presenting to you this afternoon at the Maternal Infant Mortality Summit, and very happy to be sharing with you an update on where we are with this project and really what we've learned over the course of the last 18 months or so about the system in Arizona for really working to support pregnant and postpartum women who are working through substance use disorder treatment and recovery, and how we are learning to really support moms and babies to stay together and to move safely and successfully through the journey of pregnancy, labor and delivery, postpartum, and then really into life as a whole and successful family. So just to give you a little bit of my background, I come to this work really grounded in the framework of meeting people where they are with what they need, meeting communities where they are with what they need, and really coming to understand what the challenges and barriers are, and collaboratively arriving at solutions, collaboratively connecting people, programs, and communities to resources that would be useful. My background is in early childhood growth and development, and I've spent my career working to connect community partners to create systems that support very young children and their families within the communities where they live. I'm also grounded in infant toddler mental health and really bring that frame with me to this work, supporting moms and babies to stay together. So without further ado, let's get going. And again, I'm grateful for the time today and so happy to be here with you in this conference. So why are we focusing on this population of moms and babies? Why is this the focus of really so much of the work that we're talking about today? And it's because of data. These are really data-driven decisions and data-driven programmatic approaches. And I'm pulled a couple of the most recent updated infographics into this presentation for you today. What we see here is that we have an significant increase in the length of stay. So this chart shows us for babies and mothers who are spending time within a hospital. This looks at the number of days that babies and moms are admitted into the hospital, and we see significant increases in the number of neonatal stays and the number of maternal stays because of substance use disorder. And we see that increase from 2010 really up until 2012. So this is the data that we have been seeing trending upward for the last couple of decades. We see a significant rise in opiates for mothers, 135% increase actually from 2006 to 2012. And at the same time, we see a drop in admissions for cocaine when cocaine is the drug of choice with respect to maternal admissions into the hospital. And then at the lower right of this graph, we see some newborns exposed to drugs have higher complication rates. We know that, but this is the data that we have. And this data is from 2015. And it's really this is really the most current information we have, but we know that babies that are born exposed to drugs, whether they're legal or illegal or prescribed or not, they've been exposed to a substance. Typically, those newborns have difficulties feeding, difficulty with breathing, and they tend to have challenges and maybe diagnosed with respiratory distress, and they tend to have lower birth weights. We see those challenges particularly more in babies with who have been exposed to those substances as opposed to all other newborns, which are in the purple bar. So this is our sort of baseline data picture. And if we look at Arizona then, and the information we have in Arizona about the same time frame, the previous chart was national data. So this is looking in Arizona from 2008 to 2014. And we see significant increases in narcotic exposure from 2011 to 2013. So it really mirrors the trend nationally. And we do see significant increases in diagnoses of newborns with neonatal abstinence syndrome. And the trend for those diagnoses tends to follow. And that data, it's really the national and statewide environment that Governor Ducey in June of 2017 really was faced with data that indicated a significant opiate epidemic in Arizona, similar to the epidemic nationally, and issued his first public health emergency declaration, calling for a statewide effort to reduce opioid deaths in Arizona. There was a significant amount of effort put into creating surveillance tool dashboards and toolkits and data collection opportunities to really get a better understanding of the incidence of opiate deaths in Arizona and all of the information that we could begin to collect to understand sort of where we were and the work that we needed to do. In March of 2018, the National Governors Association application was awarded to Arizona, and that technical assistance support led to the development of a statewide action plan, really focused on a cross-agency, cross-partner response to opioid-related neonatal abstinence syndrome and how we will begin to address that epidemic in our state. And it led to the creation of the Arizona Neonatal Abstinence Syndrome Action Plan. And that action plan really had three primary goals. One was to coordinate across agencies to ensure buy-in, most effective response. And the second was to increase the healthcare providers' knowledge base and behavioral healthcare providers' knowledge regarding screening, diagnosis, and treatment, particularly within the population of pregnant and postpartum women. And thirdly, to increase implementation of family-centered approaches of treatment and care for women and their newborns as they're moving through treatment. These are the three primary goals. These goals led to a couple of metrics, and just to place into perspective why we have this pilot project in Arizona is really connected to this neonatal abstinence syndrome plan. So in June of 2020, one of the outcomes was that Arizona would apply for this PPW grant. We were not successful the first time, we were the second. And so in January of 2022, so just this year, we received the funding in 2020, but we were able to have housing available, and our first woman was able to enroll in programming in January. And we're currently now able to serve 9 out of 10 beds are full, which is really great, including case management and wraparound services. And we'll get to a little more detail of that a bit later in the presentation. Second key performance metric was by June of 2020, we would expand the use of peer support specialists within substance use disorder and opiate use disorder and medication-assisted treatment sites, including ongoing training. There is work that is being done to address this, not necessarily through the PPW project. So as we move into later, more current data, so if we'll remember, those first couple of charts took us up to 2014. This data takes us another couple of years to 2016, and we see some leveling off, but we don't see reductions in rates. And so the big takeaway from this chart is that neonatal abstinence rates grew from 1.6 in 2004 to 8.8 in 2016 per 1,000 hospital births. That's a very significant increase. We do see a leveling off in 2014 and really only saw an increase from 8.1 to about 8.8 in a couple of years, again, per 1,000 hospital births. And so I am, at this point, this is the most current information, but it's a significant increase since 2011 in the numbers of babies born with neonatal abstinence syndrome. Another view, so if we were to look at in Arizona, so this looks at Arizona as compared to national data. And so in Arizona, if we look at neonatal abstinence syndrome, newborn hospitalizations, which is the chart on the left of your screen, we see over that same time period, but actually moving through all the way through 2019, we see an increase from 2018 to 19 in the rate of NAS diagnoses per 1,000 newborn hospitalizations. And so we do see the trend sort of leveling off from through 16, 17, and 18, but then a significant increase into 2019. And this is before COVID. So to keep that in mind. The chart on the right shows the national trend line for a same indicator, infants born with neonatal abstinence syndrome. And we see a decrease. The trend line nationally from 2017 through 2019 is a decrease. In Arizona, we continue to see an increase. So the data is compelling that we need to focus on this, and we need to create systems that support moms and babies, and we need to support recovery. And we need to do this because recovery is possible and we all deserve do-overs. That's our big why. We have incredibly compelling and disturbing data that tells us this is a problem in our community, in our systems. But really, we do this work, this collaborative work, because recovery is possible and because babies deserve this. So, to really get into the components of the PPW pilot project, I think that the most, certainly the most frequently occurring collaborative opportunity to engage in cross-sector discussion and relationship building and networking within this population of pregnant and postpartum women treatment providers is a learning collaborative. This is the component of the project that I'm responsible for convening, and it is really ideally an opportunity for folks working directly with families to engage with each other, to learn from each other, not feel like people are alone out on an island by themselves, and to know who is available to connect their families to and how do they do that. And we know that this is important, particularly in the landscape of COVID, where services have been virtual, staff turnover has been incredibly high, and case rates, case loads have grown because the need has gotten bigger. And so this is a mechanism to support connection between people working to support families. So I wanted to give you a slide that you can keep. You'll have copies of this presentation available through Whova. But this learning collaborative is really about connecting the people who are in this conference. So it's about you, and it's about the people that you collaborate with to serve families in your communities. So it's a cross-discipline professional networking and collegial learning opportunity to really shift the system, to ask what happened to you and to think about what matters to you and how do we support you as a mother, as a woman, to move toward what matters to you and how can we meet you where you are along that journey. So we meet the fourth Wednesday of the month from 1 to 3. It is by Google Meets. And I'm happy to send the invite to anyone interested, and my phone number or email is right there at the bottom of the screen. So please reach out to me if you are at all interested, and I would be happy to add you to that listserv. And a recurring meeting invite will dump into your calendar magically. So we have this conversation around the learning collaborative to really move toward person-centered care. And so what is patient and person-centered care? Patient-centered care, a couple of different names for really the same kind of an idea, but really looking at how do we create our engagement with families we're supporting so that they have control over their own services. There is some input from families around the amount of services they receive, the duration, the scope. It is respectful and responsive to the person's culture and language and their social and environmental needs and what they have available and what their needs are. It is individualized and strengthens the voice of the family, builds resiliency, focuses on recovery and fosters recovery, and really occurs within this focus of focusing practice of focusing on the patient occurs within provider teams and care teams, and it's a frame of interfacing and interacting with people to support them. Family-centered treatment is collaborative. really focuses on identifying treatment goals and making sure services provided will support the family to reach those goals. It's always strength-based, always focused on individual capacities, preferences, and goals, and really strives to support people in moving toward their own goals on their own path. And it is individualized, and families and parents are core participants, and really without their participation, it's really not a family-centered plan. And so those are the tenets of the work of supporting families and babies together. So within the Learning Collaborative and within the PPW sort of overall state umbrella, there are a couple of approaches that really get to this cross-sector push to create system connections that really truly support families and support families to come together and remain together following delivery. One of those approaches is Maricopa Shift, which stands for Safe and Healthy Infants and Families Thrive. I do believe Clay Jones and Megan Hayes Davis are presenting on their models at this conference. If not, we'll all be presenting at the Shift annual conference this summer or this fall in October. But this is Arizona's prenatal coordinated care plan. This is a sort of a roadmap that really outlines our approach, that there is no wrong door to services. There is multiple opportunities for families to receive support when an infant is born substance exposed and the family does need support to move through recovery and treatment safely. And this begins to identify the path that that could happen through the prenatal period into the postpartum period with the mom and service partners, community partners to support that healthy pregnancy and healthy birth. These are other opportunities to be engaged in this work, in collaboratively working to understand how we're all connected, how we can be sure that we're supporting families where they are with what they need. And both Maricopa County Shift and Yavapai Shift are open opportunities to engage in the conversation. And there are email links on this slide to contact Clay for Maricopa or Megan for Yavapai. So the Learning Collaborative, as I identified, this is an opportunity to bring folks together to learn about their work and learn about the other components within the system. And so I wanted to just walk through a little bit of the work that we've done, some of the presentations that have been made and that are planned for into October of this year. So really starting in June, you could see each month we begin with we include a woman's lived story. So we have heard from women who have been brave enough, open enough, and giving enough to share their journey through recovery and treatment and their engagement with the systems that they interfaced with. And we've really been able to learn from and enrich our work based on the stories of the people that use the system. It's incredibly powerful. So in June, we heard from our direct service provider under this project from Kodak Behavioral Health, and we're able to have a presentation from Dana Tibshraeny, which really looked at postpartum depression and really reaching out, needing to reach out to find support for women who are feeling overwhelmed and really looking for opportunities to feel empowered rather than like there's something wrong with them. And we moved on into understanding from Lauren Green with Mercy Care. She presented to the Learning Collaborative on resources available through Mercy Care contracted partners under the Substance Abuse Block Grant program, so that partners who were treating families, working with families enrolled with Mercy Care would be able to connect and utilize those programs appropriately. We were also able to hear a brand new project presentation from the Family Involvement Center that looks at healing the hurts in Arizona, just really looking at supporting trauma recovery for kids within the context of their families. We know that I'm recording this session because I am going to be out of the office in August, and this the Learning Collaborative for August was canceled. So these presentations will happen later in this fall or next spring, but we can see what's coming up in September and October. So we have lots of opportunities for updates and new projects that are happening across the state. So if this appeals to you and is interesting, please reach out to me. I'm happy to share the invite. And this is just looking further into the spring. So we've been able to add some content into February and March. So content is planned through the spring. And if you have a project or a program that you would like to present, I am looking for presenters. Please reach out to me. So the second component was a needs assessment that was completed in 2020 and this in 2021. So this report is available on the PPW website within Access. And I think these next couple of slides are the needs assessment executive summary. So this really isn't new information for those of us working in this part of our substance use system, substance use disorder treatment system, or behavioral health, or with young families. But this is the opportunity that parents had to tell their stories, and that providers were who are in the system to provide treatment to these moms and families. They were surveyed, and this is an opportunity to learn from them. We can see some data points based on Arizona data and actual data. So 56% of pregnant and postpartum women were afraid their substance use would be found out, and so they were hesitant to obtain treatment. 38% of PPW shared information about their substance use with their physician while they were pregnant, which means the majority of pregnant women who were receiving medical care did not disclose their substance use with their physician because of fear associated with having a substance use disorder. And 22% of key stakeholders, only 22% of key stakeholders said they have the information they need, which means the overwhelming majority of providers and stakeholders who were surveyed as part of this needs assessment need more information. So what are we doing with that, and how are we using that information to move forward? So these are the recommendations that came from the needs assessment, and this is really informing how we are structuring workforce development opportunities, training opportunities, cross-sector collaborative opportunities, and really working to bring multiple people to the table to have this conversation so we can shift the culture. We can make sure that everyone who is working to support moms and babies has the information they need, and that we can begin to identify moms who need support, parents who need support earlier, and we can get them into treatment sooner, because we know that that leads to a better outcome for delivery and for system interface with Department of Child Safety and other support partners after the baby is born. We know that the more educated people are, the more aware people are of the resources available in the community, will lead to enhanced system of care connections and really stronger referral pathways stronger local responsive programming that really is able then to meet families where they are, which means meeting families where they live, not expecting families to go to a different community for treatment or resources. We know that supporting the mother-baby dyad is the best practice approach and the gold standard for care. And in Arizona, we are really working to support the best practices involved in or as part of the Eat, Sleep, Console bundle of care that promotes families remaining together and is a model of care that we are really hoping that delivery hospitals across the nation, certainly in Arizona, would begin to utilize Eat, Sleep, Console as a care bundle that really focuses on the mother being considered as the medicine for the baby, and that what baby really needs is to be held, fed on demand, attached to their mother, and really engaged with and responded to in an immediate sort of way. And then we know that there are billing system challenges. That's a reality, and we are working to navigate those challenges where we can, so that we can support care providers who are supporting mom and baby dyads to be healthy and safe. And there are several opportunities for research within our state, but also nationally. And so this project and the Learning Collaborative are an opportunity to stay connected with ongoing research and what we're learning. The direct service component of the project is by far the most heavily funded, but this is the component that reaches women really where they are and provides supported transitional living for women who are pregnant or postpartum if they were pregnant within the last year and are ready to enter substance use disorder treatment. And if they need transitional housing as part of their care plan for recovery, this is additional programming available within the Tucson area. So under the PPW-PLT project, women who are access eligible and covered under Arizona Complete Health and living in the Tucson area or willing to locate to the Tucson area, there are additional beds available through Kodak Behavioral Health and Wellness is the AZCH behavioral health provider who's implementing this work. And so these pictures are a couple of pictures of the apartments that have been newly renovated under this program. And you see the list of resources that are provided for women who are engaged in services. And across Kodak's campus, there are 5 2-bedroom apartments that are all newly renovated and fully furnished. So there are 10 beds for women, and each of those bedrooms has a crib and a baby related equipment. So changing table, stroller, pack and play, high chair, all of the equipment that a mom would need to take care of her baby, and complete support for her recovery and intensive case management at the center that's really driven by mom and driven by where she wants to go and what matters to her. So if you are interested in reaching out to Kodak, please do so. You have one of the resources on the HUVA session link includes that flyer. So please share it and please refer families that may qualify. So we're working with Wellington Consulting to do data collection for this project, and they will be capturing the GIPRA data, which is the government performance data collection requirement. So as women are enrolled in the project, they'll be doing an intake interview and then a 6-month follow-up and then additional interviewing once they exit the program. And as that data comes up, we'll be able to share it. And then the fifth component is a workforce training component, which is really intended to increase the capacity of our workforce. And if you're part of the collaborative, or we've talked, you know, and that my frame and my definition of workforce capacity, increasing capacity, is really about providing more tools and resources for the people already doing the work. We don't need more people, but we need the people who are doing the work, the people who are treating and working with mothers and babies and families working through substance use disorder, really need additional support. So this is some just a set of the examples of fact sheets that we make available, or that I have made available, and training opportunities within workforce development. These are free training opportunities, free resources that are distributed across the listserv. So again, if you're interested in being on this listserv, let me know, reach out through my email. We do have some fact sheets that are current in Arizona, particularly the maternal mortality rates 2016 to 18 from Department of Health, and then Hushabye Nursery's impact report from their first 1 year of work. And then just some additional partner resources that wanted to make sure you knew were available and wanted to provide for you. So this is a clinical guidance document. This is a live link. You can download this document for no charge from SAMHSA. And it is really a wonderful set of guidance and programmatic recommendations that anybody can implement who's working with a population. We know that the percentage of opioid-related hospitalizations is racially disparate. We know that we need to do some work, particularly in Arizona, to reach women who are Black and Hispanic and Native American. These demographics don't align with our demographics as a state. So one of the requests that I've gotten from partners is for Spanish language resources for neonatal abstinence syndrome, substance use disorder, opiate use disorder, and medication-assisted treatment. And so these are links that go out to websites for free resources, and then you have some PDFs there on the left. And I believe you have those documents also within the WHOVA site. And then some clinical research that is going on currently. So the Act Now program is looking at, bringing together updates for national research across the United States through HEAL, the National Institutes of Health. And there are several clinical trials going on now around the neonatal opiate withdrawal syndrome, treatment models, and ongoing recovery models. And this is a really wonderful website and research spotlight to keep track of. And this is the end of my slides, and I think that I'm right on time. I am happy to respond to any questions you may send to me by email. You have my email here. You can absolutely call me if you have my phone number. It's not on the slide, but email me and I'm happy to respond. You can also access any information about the PPW project on the Access website. And I know that Jeanette and Dave will be more than willing to help connect me to any questions you might have through the WHOVA site. So thank you so much for attending this session and for doing the work you do every day to support moms and babies staying together and having all of the tools and opportunities they need to be healthy and safe and to continue being productive, happy members of our community. Babies deserve it. And really, this is why we do the work. Thanks.
Thank you, Kate. If you want any more information on this program, you can follow the links on Whova to learn more